Hello and welcome to my Osteopath Judith. In today's video, I'm going to go through a real-life osteopathic treatment of a baby who is suffering with colic. I'll demonstrate the techniques used in paediatric practice, and by the end of this video, you'll have gained an insight into how osteopaths treat and help babies with symptoms of colic. I'm Judith O'Sullivan, Principal Osteopath at the Mallow and Fermoy Osteopathic Clinics in County Cork, Ireland. And today we're going to be improving health and enhancing lives. Osteopathic treatment and techniques are extremely gentle and safe. When a baby is suffering from colic, their whole body can be affected. Parents often report the symptoms of colic as crying excessively, reflux, excessive wind, or difficulty in breaking wind, fussiness during feeding, sleeping difficulties, arching of the back, and holding a lot of tension into their musculoskeletal system. As you'll see in this video, osteopaths treat babies from head to toe, helping and easing all of these symptoms. Cranial osteopathy involves osteopaths using gentle pressure to release tension and correct imbalances in the body by palpating the movement of the bones and the subtle rhythmic pulsation of the CSF that we call the involuntary motion, the IVM, or the cranial rhythm. In this clip, I'm examining the natural movements that occur between the bones of the skull. During birth, when babies come down the maternal pelvis, the bones of the head overlap, and once babies are born, the unmoulding process begins. If there has been trauma during labour, for example, a long labour can place excessive pressure and compression on the bones of the skull. When the anatomical position of the skull does not allow fluid movement, this can manifest in symptoms that are associated with colic. Inside the skull, the brain is surrounded by CSF, cerebrospinal fluid, where in a healthy craniosacral system, it expands and contracts to produce a strong amplitude of between 6 to 14 pulses per minute. Here I'm treating the parietal and temporal bones, so the bones at the top of the skull and at the side of the skull. If there has been a vacuum-assisted delivery or prolonged compression of the bones of the skull as a result of long labour, this can alter the head shape. When a baby is delivered, there may be cuts of the scalp, hematomas, which are formation of blood underneath the skin, or altered head shape, for example, a cone-shaped head. Osteopathic treatment realigns the bones of the skull and helps with lymphatic drainage to decrease the swelling and promote healing. As we move from the skull to the front of the face, we focus on the E.N.T, the ears, the nose and the throat. The ears, nose and throat are intrinsically connected and form part of the upper respiratory system, and they share the same mucous membranes. When a baby has reflux, parents often report that a baby can have the snuffles. Stomach contents travel through the throat, and as the nose and throat passageways are interlinked, this can cause moisture and congestion in the nose. Here we are treating the frontal bone, the forehead. If a baby presents with congestion, I treat the frontal bone and the soft tissue surrounding the nose, which can have a beneficial effect on the lymphatic drainage to the face, helping to relieve the congestion. In this clip, I'm treating the baby's jaw joint, muscles into the face and anterior throat. If there has been any trauma during labour, for example, the cord around the baby's neck, it may cause restriction into the baby's body, such as tightening of the muscles in the anterior throat. By gently working in the jaw area and the muscles around the head and neck, this releases any soft tissue tension and helps feeding by improving the latch and sucking technique. As osteopaths, during examination, we are always looking for natural freedom of movement and balance in the body. Our necks are designed to move in different ranges of movement: flexion, extension, rotation, and side bending. In this clip, I'm checking the movements of the cervical vertebrae, the bones at the back of the head. Some children can have more tension in one side of the neck, which means they have a preference to lie on one side, which could result in tightening of the neck and also a flat head if they're lying predominantly on that side for weeks or months. Similarly, breastfed babies may feed more effectively on one breast more than the other. By gently mobilising from left to right, you are stretching out all the muscles into the neck, head and jaw area, therefore encouraging proper alignment of the head and body. Babies can have changed posture when suffering from colic and can either curl up into a ball or go into a plank-like position where they extend their spine. If babies present with torticollis, which basically means a twisted neck, due to a difficult labour or positioning in the womb, there is misalignment of the head, which can affect the muscles of the neck, shoulder and upper ribs. By gently mobilising the upper limb through the upper ribs, shoulder and elbow joint, you're encouraging normal range of movement and improved posture. In this clip, I am treating the baby's sternum, diaphragm and rib cage. As I am articulating and working into the lower ribs and diaphragm, this movement loosens out the soft tissue into the abdominal area, which reduces pressure on the stomach and the sphincter muscle, which helps decrease the symptoms associated with colic. Osteopaths use a visceral technique when treating the internal organs of the body. So, for example, the stomach. By using my hands, I am affecting the mobility and motility of the stomach, making sure the visceral attachments to the stomach and the soft tissue surrounding the organ are unrestricted. If babies are having a lot of wind issues and cramping type pain due to colic, treating the abdominal area will help digestion and reduce the pressure on the stomach, therefore reducing reflux. Babies may present with a slow and sluggish bowel or wind issues. When a baby is having an episode of colic, they arch their back excessively when they are distressed, and this excessive repetitive movement can tighten up the muscles which affect the nerves that supply the gut. So by working the lower back and spinal column, as we can see in this clip, I am working the nerves supplying the digestive system and helping proper functioning of the bowel. I am also palpating and feeling the movement of each vertebrae of the back, making sure that each one is moving correctly. Within the vertebral column, the spinal cord forms the important link between the sacrum, down here, this is the spinal column, and it goes up into the cranium, the head, and it encloses the central canal, which contains cerebrospinal fluid, the CSF. Along with the spinal cord, there are interconnections between the nerves, muscles, bones and ligaments. When a baby is suffering from colic, they hold a lot of tension into the musculoskeletal system, which can help affect the muscles in the hips and the knees. Some parents notice that it can be hard dressing their baby. For example, one leg can feel quite stiff and tight, and baby resists and locks the leg into the extended position when they are trying to get their leg into the baby grow. By moving the hip joint through a normal range of movement, this will stretch all the muscles into the pelvis, hip and lower limb. By gently moving the lower leg through flexion and extension, like the bicycle kicks, and in a circular motion, it can also help break the wind associated with colic. These leg movements are natural movements that occur in the body. As osteopaths, we never force a movement in the baby's body. So what can you expect to happen to your baby during and after an osteopathic treatment? Babies can release a lot of wind and can do a lot of stretching and unwinding of the body, which signals that treatment is working on the muscles as they contract and relax, and on the nerves as they're being stimulated, which works to improve the overall functioning of the body. Often babies can have a burst of energy and usually proceed to have a good night's sleep, or they can go into a deep sleep following treatment. It is never too early or too late for your baby to have an osteopathic treatment. In fact, the younger the better. To book an osteopathic appointment for your baby, please check with your locally accredited osteopaths. If you enjoyed this video and found it helpful and informative, please like the video and subscribe to my channel. See you in the next video. Thank you for watching.